Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Adil Ahmed. He's an orthopedic surgeon, and today's Kevin MD article is Academic Medical Centers Under Threat, the Impact of Funding Cuts. Adil, welcome to the show.
Thank you, Kevin. Thanks for having me.
All right, so just briefly share your story and then tell us what led you to write your Kevin MD article.
Yeah, man. So, brief background. I was born and raised in Texas. I went to Baylor in Houston for medical school, and then I did my orthopedic surgery residency in Tampa, in Florida. And then I did two fellowships. I did hand and microsurgery at Emory in Atlanta, and then I did a shoulder and elbow fellowship after that in Sydney, Australia. So, my practice is pretty much full upper extremity. I almost exclusively do surgeries in the arm. And so I'm here at Baylor now in my third year of practice back in Houston. And obviously, being in academics, the recent changes with the regime that has been in office since the start of the year, obviously, a lot of that has been funding cuts at the NIH, CDC, and things like that. And that directly affects academic medical centers for funding for research in particular, but also grants for other things for resident activity, travel, presentation, all that kind of stuff. So that is kind of what spurred my interest in writing this article to bring attention to the issue.
All right, so talk more about the article itself and just let us know about how it's affecting you as an academic orthopedic surgeon and as well as the, of course, academic center that you work in currently. So, what's the article about?
Yeah, the article, it starts with like any article attempts to a little attention grabber, just to hyperbolize the fact that, we get all these notifications and emails all the time, and that this was kind of like that. We got a notification that, hey, there's been some changes at the higher up level, and that is directly affecting the funding that our institution is getting. And these medical centers rely heavily on government funding through things like the NIH that fund research, but also indirectly help fund the organization as a whole, because so much of academic medicine focuses on tertiary, quaternary referrals and care for patients that may not have funding or have really complex problems. And it's not necessarily the most lucrative financial practice model. You can't just bill for the clinic visits and the surgeon and expect to cover it all. And for that reason, a lot of this funding is critical. It allows us to train our residents. And that's something I touch on in the article, that the medical training for students and residents is huge, and having opportunities for them to engage in direct cadaver labs and work with implants and things like that if they're interested in surgery, to get a little more exposure in the lab, have opportunity for projects, travel nationally, internationally to present for projects, build networking opportunities. And same thing for the faculty, right? Like continued development of your skill sets, learning a new ultrasound technique or a new surgical technique, something like that is important to stay on the cutting edge. And those kind of things start diminishing when the funding diminishes, because ultimately it's all reliant on money.
Now, when you say that it's diminishing, so what exactly would that look like? And is it just the uncertainty, or have you experienced, or did you have to supervise any cuts because of this funding?
Yeah, it's a good question. A lot of it is a bit of uncertainty and expectation of what may happen, but there have been direct cuts already. And, the main areas where we see it affecting us, like myself personally, as an academic surgeon, our stipends, our individual stipends and stuff are diminishing. Our ability to travel where the expenses are covered for conferences and meetings and things like that, which is how, we build the research collaboration of so many studies nowadays are multi-center, multifactorial studies, because that's really how you gather enough patients to have meaningful data. And your ability to go and present and discuss and engage in these conversations with your peers across the country and across the world is really what makes a lot of this research happen, a lot of it tangible. So those things have happened. Same thing with the residents, and for them even more so, building their CVs and their list of stuff they've done, right, is very important to get into fellowships, to get jobs. And if their ability to travel is decreased, that really hurts them. And those things are real. They're happening, not just here at Baylor. My colleagues all over the place. It's happening with them too.
Now, for those who aren't following the funding cuts to the NIH, what kind of dollar amounts are we talking about? Or tell us what kind of percentages in terms of how much this comprises of your research funding institution. Just give us a sense of the scope.
Yeah, it's a good question. It affects people in a variable manner. Me personally, I don't have any direct NIH funded studies, but some institutions have up to 60% of their funding coming from institutions like the NIH. The NIH gives billions. I think, again, maybe check me on the numbers, but I think around 35 billion dollars was the amount that the NIH gave to institutions in the United States in I think 2023, 2024. So it's a sizable amount of money naturally spread across a lot of institutions, but that's huge. And with cuts, the main cuts, the way that they have proposed them and are doing them is that there's a direct funding and an indirect funding, two kind of different sides of funding. And indirect funding is basically anything and everything that doesn't involve, direct, for example, procurement of cells or something like that. Like the time that a research assistant spends and obviously their salary in order to keep a database. Indirect costs are all of that stuff, factoring in publication fees because those are a reality. If you do research, you got to put it out there. Otherwise, no one's going to know about it. So all of that kind of stuff is a real cost, and those have very much been cut. The indirect funding, and that is huge for academic institutions that participate in research.
Now, there's a narrative from supporters of the administration that a lot of these cuts is because of waste, right? Because of fraud, because of abuse. So, from your perspective, is there a lot of abuse and fraud and waste happening? And are these cuts an effective way of addressing that?
Gosh, you probably ask multiple people, you get multiple answers. I mean, I'll just preface it by saying, what, this is my opinion. This is not like Baylor's stance or anything like that. I don't represent all of the institution or even all of academic medicine. I mean, I think anytime human beings are involved with anything, you have human nature. There are people that are so-called good, people so-called bad, and the reality of life is people are usually in between. And if there's an opportunity to take advantage of stuff, I'm sure there will be some people that do that. It would be foolish to claim, no, all of this stuff is going towards exactly what is written in your Excel sheet rows. The
Mhm.
funding for this goes to this. I'm sure some of it does get lumped in that term fraud, waste, abuse that we're all used to hearing. But the majority of it, I do not think it is because so much of now our ability to keep engaging in research and collaborating with other institutions and traveling and then recruiting research fellows, students that want to participate, that has diminished almost immediately because of this stuff. So it is definitely happening and it's definitely stopping our pursuit of this research.
So, are you actually seeing investigations and studies being shut down, principal investigators being laid off, their funding completely pulled? So, are you seeing that among either in Baylor or among your colleagues nationally?
I haven't seen any personally where people have been laid off because of it or they've had to stop a current study. I'm not aware, and maybe this is my naivety. I'm not aware of any like study that's already been funded and approved and ongoing that has had to halt because of it. I believe, Kevin, that this is for new grants and for new funding. And again, I might be wrong. I'm not
Mhm.
positive on that, but I don't think it's retroactive.
How about in terms of patient care? So, we talked a lot about education. We talked a lot about, of course, research. What are the direct impacts on patients who may be listening to you and wondering the impacts of these funding cuts on patient care?
Yeah, I mean, it's more so in the sense of like the continued pursuit of improvement, right? And continued advancing of the field. If, for example, 50 years ago, we had stopped pursuing research on diabetes
Hmm.
and metabolic syndrome and that whole cascade, all the advances we've seen today with medications that can better control and better prevent all of that stuff would have never occurred. It's a long-term continued pursuit. And out of everything, you have a study, an idea, a project, and it goes down a pipeline. You have so many offshoots, these so-called spin-offs that happen. I mean, that is a real way that real science happens. You have a question, you design a study and a project, and you pursue it. You may find something completely unrelated that you had no idea would come out of that, but it leads to a real thing. I mean, so much of science has happened that way, a near accidental finding, but it's just a general pursuit of improvement within science and the ability to ask questions and then execute a study, which naturally requires funding in order to find the answer. And you may end up finding a lot of corollaries that actually help patients a lot long term. So that's really the main issue in my mind is if you want to be on the precipice of excellence and keep pushing and remain, nationally leaders for the global community, you've got to fund science. And that's where I think the real harm is going to be, not directly right now to us as much as for future generations.
What's the morale like over at Baylor in terms of your colleagues, your fellow academic physicians, residents, fellows, medical students? My daughter is a pre-medical student, and last year she did the NIH summer internship program, and they
Okay.
stopped that because of this year, because of the funding cuts. So, what's it like in terms of what you're seeing among the whole cohort of people who rely on funding? What's the morale like?
Initially, right, when you hear the news, when all of us first found out about this, and naturally there was a very sharp, knee-jerk negative reaction. It was like, oh my gosh, it's doom and gloom, right? But that's kind of how human beings react to any news that's negative. And then, it kind of simmers down, you see how it's playing out, and it, it's not really something you can control,
Mhm.
so you can let it eat at you. But I think most people, we're all very busy in our clinical practices. I mean, I don't have a dedicated research or admin day. I work as an orthopedic surgeon 5 days a week and then plus call, including weekends. And so you still do that. I still am engaged in patient care, still teach residents and fellows and medical students every day, and I'm still doing my research stuff. So you keep at it, but it's just, I guess, a bit demoralizing when the support systems start eroding a bit.
So what's the response of Baylor itself? Like how are large academic medical centers like Baylor, how are they kind of preparing themselves for the next few years of uncertainty?
Gosh, it's a good question. I mean, I'm not in the higher ups or admins. I don't really know. The one thing is, just openness. I mean, Baylor's very open and honest with the faculty, like, hey, this is happening. And
Mm,
that's the case everywhere. Like as soon as we started finding out about this, I mean, I was texting my friends that are, academic surgeons and other programs. I was like, hey, is this affecting you guys? Absolutely. It's affecting everybody. And kind of the institutions are also, it's a bit of a wait and see. I mean, if you can't get funding that you used to get from the main sources, or I should probably say it's diminished. It's not that
mm.
you aren't getting it anymore. You have to look for other avenues, right? You got to get creative. And so that's kind of the impasse we're at. Like, is this actually going to happen like is proposed? And if it does, okay, what do we do? Or is it, I don't know, a little bit of bravado in the news to make a sweeping statement and then it won't pan out? We're all eagerly awaiting to see.
So one of the things that you touched upon in your article was kind of the partisanship of science and education. I think, of course, during the pandemic, there is a certain level of distrust in public health and expert institutions, of course, like medicine. So in terms of fostering nonpartisan political public support in terms of these funding cuts and better support for research and better support for these academic medical centers, what kind of paths forward do you see in terms of making this whole issue less partisan?
Gosh, I mean, I think it's a bit sad the fact that we even have to push to make it nonpartisan, right?
Mhm.
I don't think it should have ever become a partisan issue because, you're the side of the political coin, so to speak, that you sit on. I don't think that should influence at all someone's desire to know more, learn more, advance society more. I think that logically is a very collective goal. I mean, it's the collective goal that allowed civilization to happen. It's how we transitioned from nomads into city dwelling individuals over thousands of years, right? It's the collective pursuit of improvement. That collective pursuit doesn't happen when only half the population wants to do it. And so it's almost like, I think, foolish for people to be so-called anti-science. I mean, that it's not like science is a thing. It's just the advancement of knowledge. And so I think really framing is everything, right? I mean, honestly, everything is marketing and advertising these days in
Mhm.
little snippets and sound bites across our social media apps. I mean, it's become somehow painted in a negative light that, it's these scientists that are pushing some, left or right, whatever wing agenda, and that's harming us or they're being wasteful. I don't think that's the case. And I think that's the wrong way to look at the issue. It's almost creating an issue that doesn't really exist, just so for whatever end is desired, funding can be pulled or cut or repurposed. And I really think reframing and having scientists, as an example, right? Like a scientist who's very much in the public eye is like Neil deGrasse Tyson. He's
Mhm.
an astrophysicist who's very active on social media. He goes on news channels and stuff. And he's just one example, but I think he's a very good speaker. And I think he's very active in trying to dispel this myth as if science is a thing to be anti. It's just part of our lives. I mean,
Mhm.
everything we do and use day to day, it comes from that.
Now, does this issue ever come up whenever you interact with patients? And if not, just tell us the message that you want patients to know about the impact of these funding cuts.
Yeah, honestly, it doesn't really come up directly with patients. Well, what I just love patients to know is that, despite whatever happens at, these, I guess, institutional or political levels, the levels that really are not participating in patient care, we as the doctors that are treating the patients are still going to do our best because that's why we do what we do. And it's not going to stop me from caring for my patients. If someone comes in with a broken bone or needs a joint replacement for arthritis or something, I'm going to do it, right? It doesn't really matter. but it makes it more challenging to stay on that cutting edge. It makes it more challenging to educate our trainees with less resources. And the fear is, if this goes on and or potentially worsens, right? This entire generation, the current generation of trainees, students and residents, collectively may have subpar training. And
Mhm.
that whole generation is who is going to take care of the future generation of Americans. And I really hope that that is grasped, that the investment that we put in now in terms of time, energy, enthusiasm, and funding for the current generation of trainees is going to affect all of us. Me and you, Kevin, our parents, all of us. We're going to be taken care of it one day by someone who's currently in training. And it's critical that we remember that and we don't repurpose funding just for the short term. Oh, look, the deficit is cut. Yay.
Mhm.
You know what I mean?
We're talking to Adil Ahmed. He's an orthopedic surgeon, and today's Kevin MD article is Academic Medical Centers Under Threat, the Impact of Funding Cuts. Adil, let's end with some of your take-home messages that you want to leave with the Kevin MD audience.
Just stay enthusiastic for your practice. I mean, I personally don't let things like this really get in the way of how I interact with patients, my view on treating my patients, because that's the zest for why we do this. So that's one takeaway message. The other one is you may be completely separate, Kevin, from this topic, but I think it's critical that we as physicians, surgeons, whether you're in academics, private practice, whatever you do, right, you have to take care of yourself too. I'm a huge advocate of that. And, especially getting into the so-called middle age, focusing more a lot on exercise and appropriate exercise and diet. I think that's huge. And a lot of times we let ourselves go by the wayside and sacrifice a lot. It's taught to us in training to sacrifice. You can take it, you can do another night shift, you can
Mm.
be sleep deprived, but it wears on you. And if you don't take care of yourself, it's hard to take care of others. So I think that's critical.
Adil, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Kevin, thanks for having me. You have a great day. Take care.